There's still a lot to consider. Is Arizona really ready to reopen, and does the data really support that? Will relaxed social distancing actually lead to overflowing hospitals? ABC 15's Melissa Blasius joining us now. Melissa, the governor defending his position, even though it appears that some of his calculations seem to contradict that of some of our state's top infectious disease experts.
That's right, Steve. Governor Doug Ducey giving the green light to reopen the state based on what he sees as a downward trajectory for the spread of coronavirus in Arizona. But he is wavering some on that description. When he was talking about hospitalizations, he called them steady or flat. And the state's health director today, Kara Christ, admitted she doesn't know if we've peaked yet or will continue to peak. We do know the governor's take has differed from the state's modeling team, the same team that was paused and then reinstated last week, you may remember. One modeler from the team who puts out his own weekly report, Professor Joe Gerald of U of A, his report this week offered a grim prediction that only one county, Pima County, seemingly actually has that downward trajectory. The rest of the state still seeing a gradual increase. He concluded that as we all lift social distancing restrictions now, cases and hospitalizations should keep climbing, and he believes that that could ultimately overwhelm our healthcare system still. Here's Ducey's response to anybody from modelers to the media who questions his numbers.
And test to those areas, and we're putting forward guidance so that businesses can reopen and there can be another step towards a somewhat normal life.
The governor also saying that they are just following the guidance of the CDC and Dr. Fauci, the feds, and also, for the most part, the most important thing that the governor was talking about today is how all of this directly affects you and me now. He says that if you are vulnerable, such as someone who is immunocompromised or elderly, he encourages you still to stay at home as much as possible. For the rest of us, he is continuing to offer ideas how to protect our public health through hand washing, social distancing, that 6-foot distance from other people when you're out in public, as well as things like wearing masks and, of course, staying home if you feel ill. I'm investigator Melissa Blasius, ABC 15, Arizona.